All right, so basically what I do is I'm analyzing the spine. I usually start from the base of the spine or the sacrum or the sacroiliac joints up. So we use leg length as a determination to see if there's any misalignment in the hips. We see the left foot is, or left leg is considerably shorter, about 1/4 of an inch, give or take, than the right. So we need to determine if it's which way the hips are rotated out of position. Pain when I push there? Not too much? Okay, and if you notice, stay the same. So now we're gonna go to the opposite side. How about when I push there? No? Okay. But if you notice, now the leg length is perfect. So that tells me which way the hips are rotated out of position. It allows me, it just gives me the determination of which direction to adjust. If you take a deep breath in, blow it out, relax real nice. Good. Good. And down. Relax. Okay, just relax real nice. Straight as an arrow.
Oh, thank you.